Welcome to The Explainer. Today, we're tackling something that sounds like it's straight out of science fiction, but, well, it's happening right now. 3D bioprinting.
Just think about that for a second. Imagine a world where the long, agonizing wait for an organ transplant is just a thing of the past. A world where you could get a new kidney, a new liver, maybe even a heart, built from the ground up, layer by layer, as a perfect match for you. And trust me, the need is absolutely staggering. That's roughly how many people are on the organ transplant waiting list right now just in the United States. To put that in perspective, that's like filling an entire football stadium with people whose lives are just hanging in the balance. It really highlights the urgent need for new solutions.
But this isn't just about organs. We're talking about something much bigger. This is about fundamentally changing how we repair the human body, from, really complex injuries to debilitating diseases.
Okay, so let's dive into what this actually is. At its core, bioprinting pretty much combines 3D printing technology with biology to build things that are, well, literally alive. It uses these special bioinks, which are just biomaterials mixed with living cells, to print living structures layer by tiny layer until you have functional human tissue.
So how do you really go from a digital file on a computer to a piece of living, breathing tissue? Well, it turns out it's a fascinating multi-step process.
Okay, so first things first, you need a design. You create a digital 3D model, and what's so cool is that it's often based on a patient's own scan, so it's a perfect custom fit. Then you've got to prepare that special bioink, which is essentially living cells suspended in this gel-like scaffold. From there, it's time to print. A bioprinter carefully lays down that bioink layer by layer to build the 3D structure. And finally, and this step is absolutely crucial, the printed object gets placed into a bioreactor to grow and develop into actual functional tissue.
And this quote from Professor Hollis Raycott really just hits the nail on the head. It perfectly illustrates the biggest challenge here. Trying to mimic nature's incredible complexity is, well, it's incredibly difficult. But it's also where researchers are making some of the most exciting breakthroughs.
For instance, get this, researchers can now print synthetic bone with a resolution of 300 nanometers. We're talking about a level of precision that lets them mimic the tiny, intricate structures of natural bone like never before. It really is getting us closer than ever to recreating the body's own masterpieces.
So let's move this out of the lab and into the real world. Let's see how this all comes together to build an actual solution for a patient.
Okay, so this recent case report walks us right through the whole journey. Here's the problem. A 46-year-old man is missing a tooth and doesn't have enough jawbone for a standard implant. So what's the design? Using his own scans, they design and 3D print a perfectly fitting scaffold that his body can actually absorb over time. Then comes the surgery. They implant that custom scaffold to guide the regrowth of new bone. And the result? 6 months later, the scaffold did its job perfectly, guiding new bone growth and creating a stable foundation for a successful dental implant.
And here's the crucial number. The patient experienced this much volumetric bone gain. I mean, think about that. That's creating a solid foundation for a new implant where, before, there is basically nothing. It's a total game changer.
And, this isn't just an isolated case. An entire industry of innovative startups is popping up and pushing the boundaries of what's even possible here. We're talking about a full-on bio-revolution.
I mean, just look at this world of innovation. What's so wild is the sheer diversity of what's being developed by companies all over the globe. You've got CollPlant bioprinting lungs for transplantation. Aspect Biosystems is 3D printing knee meniscus tissue. Brinter is printing patient-specific cancer tumors to test new drugs. The list just goes on and on. Vascularized tissues, reconstructive surgeries, liver tissues. It's incredible.
But, with this kind of revolutionary potential, it's really no surprise that it comes with a whole host of significant ethical and regulatory challenges that we absolutely have to navigate.
And really, we're faced with a classic kind of trade-off. On one side, you've got access versus cost. I mean, how do we make sure this kind of personalized medicine doesn't become something only the wealthy can afford? And on the other side, you have safety versus innovation. How do you rigorously test these living implants without slowing down progress that could literally save lives?
And this is exactly why this all matters so much. As you can see from this chart, there's no single global standard for regulation. The US and Europe are scoring higher on regulatory readiness than other regions, and that creates this fragmented, uncertain landscape for actually bringing these products to market safely.
So, ultimately, the era of printed biology is here.
That's a fact. The question is no longer how we build with life, it's how we choose to. This technology is forcing us to confront some really fundamental questions about how we define medicine, enhancement, and, well, the very future of human health.